Endometriosis is a very distressing disease, and it is seen in all age groups. You can see it either in the adolescents, in young adults, as well as it can also be seen in after 35 years, in the later years of life. And what happens is during usually it is a clinical diagnosis more than through investigations. Clinically, when the patient comes with a history of severe abdominal pain, which usually starts sometimes 3 to 4 days prior to her starting of menses, and throughout the period of menses she will be having abdominal pain, and it may even last after the completion of her periods. So when a patient gives such distressing symptoms, the most common symptom that we find in endometriosis is abdominal pain. And so another thing is that sometimes when we take what we have to rule out when she comes with pain, we usually symptomatically we treat her first. We can, if she's having pain, you can give her, if she's not married, if it's an unmarried person, you can give her non-steroidal NSAIDs, non-steroidal anti-inflammatory drugs, and see whether her pain is subsiding. If she has no relief, then you can think of the next. There are so many now new drugs have also come for endometriosis, like Dynogest is also there. So depending on the age group we decide, and depending upon what the patient desires, we decide the treatment for the patient, depending on whether she's married, or whether she has completed her family, if she is an adolescent. Like depending on the age group we decide, and depending upon her symptoms we decide as to what treatment has to be given. Some patients even have increased bleeding during periods. So what is endometriosis? Actually, by endometriosis what we mean is the uterus is lined by endometrium. There is a thin layer inside the uterus which is called the endometrium, and this endometrium is shed during periods. So when this endometrium should be seen actually only inside the uterus, but in some people you can see this endometrium outside the uterus. It can be seen on the ovaries, anywhere. Sometimes it may be seen on the back of the uterus, like other than inside the uterus. When it is seen outside anywhere, then that is called endometriosis. And when the patient has her periods, from all these points where there are these endometrial deficits, the patient starts bleeding. So leading to formation of lesions, pain, and things like that. So first is the clinical diagnosis, and then depending upon what the patient desires, we go ahead with the treatment.